Hello, everyone, and welcome. I'm Paz Artaza Regan, Program Manager at Catholic Climate Covenant. We are going to get started with the first webinar of 2018, Protecting Health and Life, a Catholic response to the proposed Clean Power Plan, Replace and Repeal. In this webinar, we're going to look at what's at stake with the proposed EPA repeal and replacement of the Clean Power Plan, or CPP as you'll hear it called. We're going to explore how the Clean Power Plan has been seen as the best available path to achieve the carbon reductions that would meet the Paris Climate Agreement commitments. How social Catholic teaching talks about these issues and what it has to say about carbon emission reductions and climate change issues, the health impacts of air pollution and climate change, and the health benefits of carbon reductions. We're also going to look at how we might respond to the likely action of repeal and replace of the CPP from both Catholic Climate Covenant and the American Lung Association's perspectives. Some important information before we get started. The video is being recorded and the link will be included in next month's newsletter, as well as the whole recording will be available on Catholic Climate Covenant's website. We will have a Q&A session after both presentations. You may submit your questions by writing them in the chat box that's available on the lower left side of your screen. You might need to scroll down to see the box. The questions and comments, though, are only seen by presenters, not by the entire folks that are attending. If you have some audio issues or connectivity issues, they may be due to your Wi-Fi connection. We've asked AnyMeeting and they told us to have you try to connect via phone for better audio if you're having that issue with your computer. You also might have some better luck if you connect through browsers such as Chrome or Firefox. At this time, I would like us to pause for a couple of minutes and get ourselves centered and remember that we're always in the presence of God, and to do a small reflection. And let us go with the reflection here. Hold on a second. This is a reflection that is based on a plea from Pope Francis. Whenever we fail to care for our brothers and sisters in creation, the way is open to destruction, and hearts are hardened. God grant that all who have positions of responsibility in economic, political, and social life, and all men and women of goodwill, grant that we be protectors of creation, protectors of God's plan inscribed in nature, protectors of one another and of the environment. Amen. Let us get started, and we have two presenters today. We have first going in will be Jose and then Lindsay Mosley Alexander. And let me give you a little background on our speakers. Lindsay Mosley Alexander is Assistant Vice President and Director of the American Lung Association's Healthy Air Campaign, a national campaign to win strong outdoor air pollution safeguards to protect all from the dangers of breathing air pollution. Previously, she held positions with the National Religious Partnership for the Environment, the Energy, Environment, and Resources Center at the University of Tennessee, and Sierra Club. She holds a Master of Public Administration degree with a certificate in Environmental Policy from the University of Tennessee, and a Bachelor of Arts in Public Policy Analysis with a minor in History from UNC at Chapel Hill. Jose Aguto is the Associate Director at Catholic Climate Covenant, where he directs our advocacy and program work. Previously, he worked for the Friends Committee on National Legislation, where he initiated the Call to Conscience on Climate Disruption, an interfaith grassroots call to Congress for bipartisan recognition of the reality, science, and impacts of climate change. He's also worked for the National Congress of American Indians in the service of tribal governments seeking to address climate change. Jose is a graduate of Brown University and Villanova Law School. We're going to get started with Jose going first, and then afterwards, Lindsay. Jose, take it away.
Thank you so much, Paz. It's a blessing to be among all of you today, all of you concerned about our natural world and the people within it and our shared future. I'm going to speak today about the Clean Power Plan, its basic features, its status, its history, and what we can do about it as Catholics. To continue to promote a climate action agenda within our nation and our world. And then hand it off to Lindsay to talk about the public health aspects of climate action as well as the Clean Power Plan. So a brief primer for many of you who have been familiar with the Clean Power Plan. It was announced by the Obama administration in August of 2015. Its overall intention was to reduce our nation's carbon emissions 32% below 2005 levels by the year 2030. There is a lot of flexibility built into the plan, allowing each state to achieve specific levels or rates of emissions, allowing the states to decide how much of their energy mix they need to alter in order to meet their state-specific greenhouse gas reductions, and companies are allowed to buy and sell allowances to balance out their own specific carbon emissions. Moving to the second slide. Thank you, Paz. Sorry, I'm not able to access that. This slide is shows the emission reductions that each state was obligated to reduce. We have as low as 11%, for example, in North Dakota, and as high as 72% for the state of Washington. And Washington was or is able to meet that merely by closing their sole coal-fired power plant. And we were also seeing during this time that many of the states, even if they objected to the Clean Power Plan, would still be able to comply with it, given the changes in the energy mix that are still happening, where a lot of coal-fired power plants were going offline because they weren't economically feasible, and there was a glut of natural gas on the market that was resulting in the closing of many coal-fired power plants, for example, in Kentucky. So actual compliance is not that difficult for many states, but many states did object to some of its features, which we'll get into a bit later. Okay, so many of the benefits of the Clean Power Plan include incentivizing energy efficiency improvements for low-income communities, and this is very important because it also not only helps low-income households reduce the percentage of money that they have to dedicate to energy, which is generally higher than all other families, but also creates jobs and economic opportunity for energy efficiency companies. Job creation would also happen with improving grid reliability. There were programs to enhance clean energy technology and deployment, saving American families about $85 per year by the year 2030, reducing energy to power 30 million homes, and to continue American leadership on climate change. And I wanted to focus on that a little bit because the Clean Power Plan, one of the greatest benefits of it is that it demonstrates American commitment to greenhouse gas reductions. When the plan was announced, it then gave the United States the hook, if you will, to encourage other nations to engage in their own commitments to greenhouse gas reductions, thus paving the way to negotiations that our country had with other countries, both bilaterally and internationally, which resulted in the Paris Agreement in December of 2015. And so not only do we demonstrate within the United States our willingness to engage in climate action, but we also then inspired the rest of the world to do so. And as many of you are familiar with regard to the Paris Agreement, there were 194 nations that recognized that we, the world, need to reduce our greenhouse gas emissions to prevent a 1.5 Celsius increase in the global temperature. And we can only get there by global cooperation. The public health benefits I'm going to leave to Lindsay. But you see them right now, and Lindsay will talk about them. But clearly, public health protections are key and central to what we as Catholics care about. So currently, there is obviously a track record here and a lot of contention, as you've seen, and particularly in the present. Where 27 of the states objected to the Clean Power Plan and took it to court. And the Supreme Court in February of 2016 halted the implementation of the Clean Power Plan, leaving it to a lower federal court to weigh the ruling, which the Supreme Court could then take up again as well. But all of that has sort of stayed with the Trump administration in place, and their intention, which they announced on October 10th, 2017, issuing a proposed rule to rescind the Clean Power Plan. And there was a typo there. And in December of 2017, EPA issued an advance notice of proposed rulemaking. That is a request for people to comment on the legal basis for a new rule. The Catholic Climate Covenant's position, which we expressed at the only public hearing that EPA offered in Charleston, West Virginia last November, is that we urge EPA not to revoke the Clean Power Plan. And you can find this on our website. Echoing the USCCB's concerns, it does risk damage to our air, our waters, and most importantly, our people, particularly the poor and vulnerable. And the USCCB has been vocal about its support for the Clean Power Plan, and also itself expressed disappointment with the EPA administrator's decision to issue this proposed rule, considering repeal of the plan. If EPA does choose to repeal the Clean Power Plan, which it is strongly indicating it will, although it is not confirmed, we ask that it remain in place until an alternative is proposed, approved, and implemented, and that alternative should meet or exceed the Clean Power Plan's national carbon emission reduction goals of 32% by the year 2030 relative to 2005 levels. We also insist that the public health protections, which I mentioned earlier, also be met or exceeded in the alternative plan. Some of the objections that the states and some of industry folks and also the Trump administration have voiced with regard to the Clean Power Plan. Number one, that they feel like it's federal overreach and tramples on states' rights and their ability to dictate each state's energy mix. And also, a second theme is that it reaches beyond the fence line, and by that, beyond the fence line of power plants, of the applicable power plants. And so some of the features of the Clean Power Plan, such as allowing for energy mixes and support of deployment of renewable energy and adding energy efficiency benefits to each state's requirements, exceeded the scope of the Clean Air Act. And so many of the objections are along those lines. There are objections in principle, objections with regard to the legality, objections with regard to the time frame, not per se to the benefit of helping us, our nation and the world, reduce our greenhouse gas emissions. Our position as Catholics is grounded in our social teaching and in our theology. We feel at the Covenant it's important to note, because there's a lot of public perception that this is Pope Francis's own initiative and that he's going off the record with regard to previous Catholic theology. And so we lead with what previous popes have said, starting in 1971 with Pope Paul VI, stating that man is suddenly becoming aware that by an ill-considered exploitation of nature, he risks destroying it and becoming, in his turn, the victim of this degradation. And we see that the two previous popes, St. John Paul II and Pope Emeritus Benedict, also known in other circles as the Green Pope, have affirmed and advanced the Church's call for us to care for creation very explicitly. And we also ask you to affirm this longstanding strain of papal teaching and support for care of creation, which also translates to our care for the poor. Also noting that care for creation is explicitly one of 7 themes of Catholic social teaching. You can see that on USCCB's website. And that, of course, Pope Francis has recognized climate change as a problem which we can no longer be left to a future generation, and that we are living at a critical moment in history. And that Pope Francis has also called for immediate reductions in greenhouse gas emissions and shifts away from fossil fuels in order to achieve that goal. Lastly, we at the Covenant want to redouble our efforts to engage with you on what we can do to bear public witness and to strive for a thriving future filled with climate action and the deployment of renewable energy and safety for all peoples from the impacts of climate change. So we urge you to provide public comments to the Clean Power Plan's proposed repeal. The deadline is January 16th. We encourage you to write letters to the editor and op-eds, and we have resources for you on our website to help do that. And we are more than willing to talk with you to help you do that vis-a-vis your own local media and newspapers. And tomorrow, if you are living in the state of Maryland, feel free to attend their hearing, which is a state-led hearing in response to the fact that the EPA administration only allowed one public hearing. So feel free to attend that. The states of Delaware and New York State did so a couple of days ago. And so we thank all of those of you who decided to attend or participate in those meetings. And lastly, I wanted to say, and many of you know this already, but in this, and I'll finish with this final remark, in these highly divided times, faith transcends partisanship. Our Catholic faith, the moral grounding of our Catholic faith, when properly applied, is more than enough to help reduce this partisanship and build bridges and to elevate this issue as something that is not partisan, but is something that we all care about. And by elevating our love of neighbor and our love of enemy and speaking and acting in humility, we can transcend the difficulties that we are encountering now. With Christ-like behavior, let us all move forth and strive and achieve a thriving future. So thank you so much for listening. And Paz, I hand it back over to you and Lindsay.
Thank you, Jose. At this point, Lindsay, if you could come up and start your presentation.
Thank you, Paz and Jose, and all of you for joining today. I'm so pleased to be with you. I come from the American Lung Association, which is the America's oldest voluntary health organization. We've been around more than 100 years and have led the fight for healthy lungs and healthy air through research, education, and advocacy. And one of our key objectives is to improve the air that we breathe so that it does not cause or worsen lung disease. And it has become very clear that addressing climate change is a critical part of our mission if we want to continue to improve the air that we breathe so that it does not cause or worsen lung disease. So I'm going to cover 4 key points: the health impacts of air pollution and climate change, the health benefits of the Clean Power Plan and impacts of EPA's proposed repeal, the Lung Association's position on the proposals to repeal and replace the Clean Power Plan, and a few tips on advocating from a health perspective. So first, the health impacts of air pollution and climate change. These images here, as you can see, are a good reminder of the progress that we've made in the United States when it comes to reducing pollution from coal plants and vehicles and other sources. Several of these are taken from Birmingham, Alabama, for example, in the early 70s. And we can be thankful that large parts of the United States no longer look like this. The American Lung Association, for more than 18 years, has analyzed data from official air quality monitors to compile an annual report, our State of the Air Report, which grades counties for ozone pollution and particle pollution and ranks cities on these same pollutants across the United States where we have data from monitors. Last year's report found that thanks to the success of the Clean Air Act, the United States has experienced continued improvements in both ozone pollution and year-round particle pollution, which are two of the most widespread. But much work remains because more than 125 million Americans, or 4 in 10 people, lives in counties with unhealthy levels of ozone or PM, either getting an F for one or the other of those two pollutants, and more than 18 million people live where the air got all Fs on our measures. And furthermore, it's not clearly just a problem still in the United States, but the World Health Organization reported in 2012 that around 7 million people died that year alone as a result of both indoor and outdoor air pollution. So there is still a great deal of progress yet to be made. So what are the health effects of these pollutants? Ozone and particle pollution are two of the most widespread and most harmful. They are both impacted by climate change, and we'll talk more about that in a minute, but they can cause harm to health in many, many ways outlined in this chart, including causing asthma attacks, cardiovascular and respiratory harm, and new evidence is showing harm to newborn babies. Particle pollution can also cause lung cancer, and the most serious impact is premature death. When it comes to climate change, can impact air quality in a few key ways. Hot, stagnant air episodes from climate change can lead to drought, dust, and enhanced conditions for ozone pollution formation, which, as I mentioned, can lead to asthma attacks, heart attacks, and strokes, developmental harm in children, and many more adverse health consequences. Longer and hotter wildfires can lead to smoke and particle pollution, and it can travel hundreds of miles from the original source, leading to many of those same health effects that we just covered. And then, of course, we are facing longer allergy seasons and increased allergen counts, which can worsen allergy symptoms for people with allergies and some who also have asthma. So we'll take just a minute and look at each of these. Warmer, stagnant air means ozone pollution is more likely to form. Ozone develops in the atmosphere from gases that come out of tailpipes and smokestacks like power plants and many other sources. And when these gases come in contact with sunlight and heat, they react to form ozone smog. The essential raw ingredients for ozone come from nitrogen oxides, hydrocarbons, also called volatile organic compounds, and carbon monoxide. And several of these that I just mentioned come out of smokestacks from power plants alongside carbon pollution, which is the subject of the Clean Power Plan. We'll talk a little bit more about that in just a minute. When we look at some of the key projections under various scenarios of climate change, you can see how temperature, ozone levels, and premature deaths that would be attributed to climate-related ozone levels may be affected in this chart. The top is a higher emissions scenario, the bottom is a moderate emissions scenario, and it is complicated. We're not describing a linear relationship between heat and ozone, but in some parts of the country, we would expect to see increases in premature deaths associated with climate-driven ozone increases under both scenarios. Let's consider wildfires and climate change. This map shows projected percentage increase in weeks with risk of very large fires by mid-century, so 2041 to 2070, compared with the recent past of 1971 to 2000. And this is based on a higher emissions scenario. And you can see that we can expect to see a substantial increase in very large fires. And I'll just note that the recent wildfires we have seen out west illustrates in a powerful way how damaging and disruptive wildfires can be to a community. And just because you may not live near a fire that's actively burning, it doesn't mean that you aren't also at risk from particle pollution from the smoke. Wildfire smoke can travel thousands of miles, just like it did during the fire scene here from Quebec, Canada in 2002, with smoke traveling as far south as Baltimore, Maryland, this satellite imagery shows. And one more point when it comes to air quality and lung health and climate change. Rising temperatures have already led to an increase in ragweed pollen season length in central North America between 1995 and 2011 by as much as 11 to 27 days. For those who suffer from allergies and allergy-triggered asthma, such dramatic changes directly impacts their health and their quality of life. So who is most at risk? And I think from a vulnerable population's perspective, you can see here that the list is quite long. Infants and children, including my son, who's there pictured with the blue background. I threw him in as just brings a smile to my face, I hope to yours as well. But infants and children are still developing and spend more time outdoors. Older adults are also more vulnerable, as well as people who already have a health condition like asthma, COPD, or other chronic lung health problems, as well as people with diabetes, cardiovascular disease, people living in low-income communities, and people who work or exercise and spend a lot of time outdoors tend to be more at risk. I want to point out here that climate change doesn't affect every area the same, and this slide shows some of the regional impacts. Just a snapshot, this is from the National Climate Assessment issued in 2014. I think this is important, especially if you want to personalize your concerns or your comments to EPA and show effects to your community. And each of these impacts also has a different impact on health. And so you can look at your regional climate impacts, what's expected, and then correlate that with health impacts that can come from, say, wildfires or degraded air quality. And that can help you personalize and tailor your comments to EPA. So the benefits of the Clean Power Plan and the impacts of EPA's proposed repeal. EPA's Clean Power Plan provided states with a set of flexible tools to reduce carbon pollution from power plants, as Jose said, by making power plants more efficient or using cleaner sources of energy or lower emitting power and using electricity more efficiently. Implementing the Clean Power Plan according to EPA would not only reduce carbon pollution by an estimated 32%, but would also reduce other emissions that harm health, many of which we've just talked about. These other pollutants being reduced, this is known as a quote-unquote co-benefit. So the targeted pollutant is carbon pollution, but taking steps to reduce carbon pollution also reduces many other dangerous pollutants. And in 2015, EPA estimated that the Clean Power Plan would prevent up to 3,600 premature deaths and 90,000 pediatric asthma attacks. I'm going to put a marker here that these numbers have been revised by EPA, but that's a tremendous starting point. EPA is not the only resource that has documented the health benefits, the co-benefits of reducing carbon pollution from power plants. Scientists at Harvard and Syracuse University and Boston University, they found a strong carbon pollution standard for power plants would reduce other pollutants, namely ozone precursors and PM 2.5 substantially, and their estimates showed 3,500 premature deaths would be avoided and 1,000 hospital admissions from heart and lung disease avoided in 1 year alone. I want to also point out from this study that they took a look at a so-called inside the fence line approach, which is what EPA is considering as their replacement. And actually, their research shows that it could be worse than doing nothing. And in fact, taking an inside the fence line approach where you only focus on individual power plants could result in increases in dangerous and deadly pollution and premature mortality associated with that. So that's something that the American Lung Association is definitely emphasizing in our comments to EPA about the proposed repeal of the Clean Power Plan and the way in which EPA is considering replacing it. This is an example of the benefits that Harvard study I referenced that they documented for the state of Virginia. They have this for many states. I'm not sure if they have this for all 50 states, but they have charts like this for many states, so we could try to help you find out whether this information is available where you live. One additional study looking at the health co-benefits of reducing carbon pollution comes from an evaluation of the Regional Greenhouse Gas Initiative in the Northeast that found nearly $11 billion in health costs and premature deaths were avoided between 2009 and 2014, in part due to the carbon limits under the Regional Greenhouse Gas Initiative. Not exclusively, but a lot of those benefits were attributable to the carbon pollution limits. So I mentioned that the numbers have been revised. EPA recently, in a set of documents released to the public alongside EPA's proposal to repeal the Clean Power Plan, EPA included an updated analysis of what they call the foregone benefits of repealing the Clean Power Plan. So I mentioned earlier that EPA in 2015 estimated 3,600 premature deaths could be avoided by the Clean Power Plan. The updated estimate from EPA, from the technical staff at EPA, actually identifies that the Clean Power Plan would have done more to protect health even than EPA estimated in 2015, and up to 4,500 additional premature deaths each year would result from the Clean Power Plan, or could be avoided if the Clean Power Plan were implemented. And in addition to that, and related to that, increases of pollution, sulfur dioxide, nitrogen oxides, and CO2 associated with the repeal of the Clean Power Plan, you can see there on the screen, all of which are substantial. So the American Lung Association's response to EPA's push to repeal and replace the Clean Power Plan is an integrated campaign that where we are engaging in media advocacy, mobilizing our health and medical partner organizations, advocating in front of decision makers, mobilizing our grassroots, leveraging all of the state-of-the-art research and data collection and evaluation that we've done, that others have done, and we are also involved in litigation around the Clean Power Plan. From a media advocacy perspective, we're working really hard to define this issue in terms of what it takes to protect health, and I was struck by something Jose said about the faith transcends partisanship, and I also believe that health transcends partisanship, and taking measures to protect our health and to protect the health of our children and our families is a message that resonates far beyond the partisan divides. And there's polling research that also supports that assertion. And so we work very hard. This is a sample of highlighting findings of the state of the air and the impacts of climate change on air quality. And Chris Wallace on Fox News actually used that to question EPA's administrator, Scott Pruitt, about the health impacts of repealing the Clean Power Plan, showing that Fox News thought that message would actually resonate with their viewers as well. This is an example from the Los Angeles Times, where we're really trying to drive the headlines that helps put the spotlight on the health impacts of the decision to repeal the Clean Power Plan. What does that mean for the health of people across the nation? Likewise, I mentioned the coalition work that we are doing. This slide shows many of the national organizations who have signed on to a declaration on climate change and health that calls it an urgent problem that requires bold action. And so we coordinate together to make our voices heard to EPA and to others, especially at the state level for those states that have been considering action even despite federal action on the Clean Power Plan or to limit carbon from power plants in their states. We are working to leverage support for that state level action. We are together strongly opposed to the repeal of the Clean Power Plan, and we are urging EPA to strengthen the Clean Power Plan if they decide to replace it, not weaken it, because what's clear now is we can do more than what even the Clean Power Plan required as a nation. I want to make a note about a tactic that we're using, or it's a communications push to frame this issue, is real people are sharing their stories. Each of the people here on this screen have a connection to air quality and their health that they have articulated to decision makers in support of policies to protect the air we breathe. And I think that that is a very effective and powerful message, and important to for decision makers to hear from all of you in the same way. So a few tips on advocating from a health perspective. As you are making comments to EPA, as you are crafting letters to the editor or op-eds, I would really encourage you to include the health impacts of these decisions to help inform the debate. A lot of people don't think about the health impacts of climate change and pollution from power plants, and the more they know, the better we all will be as we try to make collective decisions about how to move forward as a nation. Sharing your story is an incredibly powerful way to shape the debate, not only in your comments to EPA, but in meetings with decision makers and in your communications with media through letters to the editor or op-eds or interviews. Certainly showing up in person and incorporating the health message into what you have to say in those public hearings, for example. I have included 2 links here to letters to decision makers that the American Lung Association has organized. If you're looking for a sample or you want to see what we've done, one is a sign-on letter for all parents and grandparents, really thinking about the responsibility for the next generation is sort of the genesis of that letter. And then we have a sample comment that everyone can submit to EPA on the screen there. And again, as Jose said, faith can transcend partisanship. I also believe that the health message can and does transcend the partisan divides, and I am inspired by the work that you are all doing and that the Catholic Climate Covenant is doing. And I'll hand it back to you, Paz.
Great. Thank you so much, Lindsay. That was comprehensive and very, very helpful. At this point, we're moving to the Q&A section of our presentation. The system has changed a little bit how you do your Q&A, it seems. So you have a different place to write your questions. I can't answer them by writing in there anymore. So we're going to try to answer them here one by one. The first one I've got is for Jose, and it has to do with your map that you showed at the beginning of your presentation. And that map refers, the question is, does the map on CPP goals connect only to coal plants, or does it also talk about natural gas and fracking? And that was a question. Remember, Jose, that map with the emissions reductions to the side?
Yes, indeed. So those percentage reductions that each state is required to meet can be met by a flexible choice of options. It doesn't. They don't apply only to coal-fired power plants. They can be met by they could be met by reducing those or closing down those coal-fired power plants, but also, for example, improving the energy efficiency efforts within the state. So the short answer is no, not limited to coal-fired power plants.
Right, and so they can switch from coal-fired plants to natural gas, for example.
That's correct.
Right. I think that's what the question was. And as to whether or not when we are asking during repeal and replace, that we also push the fact that methane is a powerful greenhouse gas that comes from natural gas production.
That's correct. And also some of the studies are coming out that when you talk about leakage that comes from methane and all of the environmental impacts associated with fracking, that the methane could potentially be, in some cases, a worse outcome than coal.
Correct. Okay, excellent. The next couple of questions I'll do very quickly were questions about whether or not the recording and slides would be available. The recording will be up on our website probably by tomorrow afternoon. I'll have to check as to the slides. I don't know if those will be allowed to be on. I'll check. And the second question was about where to go to submit the advocacy question, the comment question. And that is, I put it on the chat box. It's www.catholicclimatecovenant.org EPA.gov/advocacy. And there you'll find the link to submit a comment to EPA. The next questions are, I think, more for Lindsay. Lindsay, and they have to do with how you had to go so fast on some things. Could you clarify what PM 2.5 is, the fine particle matter, what that means? And also, what do you mean by inside the fence? And why inside the fence is more dangerous?
Yes. Okay. So starting with particle pollution, and I apologize, I should have mentioned, particle pollution are the tiny particles that are released from smokestacks and tailpipes, also from wildfires and a household fire, any kind of wood-burning fire. So tiny little particles that are released into the atmosphere that we inhale. And when we inhale them, they can lodge deep in our lungs. And they can even cross into our blood, which is the connection to heart attack and stroke. But they can, so as we breathe particles into our lungs, they get lodged there, and they can lead to asthma attacks, heart attacks, strokes, premature death, lung cancer as well. So that's what PM 2.5 refers to, the tiniest particles that can get past our natural defenses as we inhale them. So that's the first question. The second one, was that the inside the fence line?
Yeah,
Question,
inside
Paz?
the fence, what it means and why it's more dangerous.
So EPA, this gets a little technical, so indulge me for just a minute. Under the Clean Air Act, the authority under which EPA developed the Clean Power Plan is to limit carbon pollution from power plants using what's known as the best system of emission reduction. So there's a debate going on of what is a system of emission reduction and what's the best system of emission reduction, because that's the standard EPA has to meet as they set their limits for carbon pollution from power plants. Under the previous administration, EPA argued that the power system itself was that the power grid was a large system. So power plants integrated into the distribution facilities and to the end users was all one big system, and that the best way to reduce carbon pollution within that large system were those buckets that I identified that involve things like reducing reliance on coal-fired power and shifting to natural gas as one way to do it. Shifting to other fuels like co-firing with biomass tends to reduce less carbon emissions, but it can reduce. It can actually increase particle pollution. So first, that question of what is a system of emission reduction is a debate. So on the one hand, the previous administration said it's this very large system that's integrated, including end users. So, EPA tried to incorporate energy efficiency as well into the system. The current administration says we only have the authority to require changes at a power plant itself. So if you envision a power plant kind of inside a fence, the reference is to power plants only instead of this larger view of a system. So the power plant would be the system, and the boiler, individual boilers on a power plant facility would be the system that this administration wants to regulate, instead of taking that broader view of what is the system that needs to be regulated. And so the solution under each of those views of what is your best system of emission reduction is different. Under an quote-unquote inside the fence line approach that only looks at what kinds of changes can be made to reduce carbon pollution at a power plant, your solution options are very limited. You can tweak things like the heat rate efficiency of the boiler. You can, they're very limited options. You can maybe change the kind of fuel that is burned on site within that facility, based on, depending on the limits of your technology at that facility. And EPA hasn't made it clear what within that fence line they would do. However, the study I referenced from Harvard looked at, they took an approach and said, here's what we think they can do with if they only look at the options available inside the fence line or at power plant by power plant, making tweaks to each power plant, and found that in some cases, some power plants would have to run more, and that would release more of the other pollutants that come out of those smokestacks that lead to ozone and PM, and that would lead to increased premature mortality. So they looked at it system-wide and modeled some of the different choices that EPA could consider under a really strong standard like the Clean Power Plan and under a very weak standard that you would find associated with a quote-unquote inside the fence line approach, and in fact found that in some cases power plants would have to operate more, and that would release more pollution that leads to more premature death.
So in some ways, you might have carbon reduction, but it comes at the cost of increased ozone and particles, fine particle matter, correct?
They did, Harvard did find that there would be, I think it was maybe a 2.2% reduction in carbon pollution, so very small compared to the 32% reduction that EPA projected under the Clean Power Plan. So, nearly 30% difference. And instead of having these added co-benefits of other pollutants that are being reduced, in some places you actually see those other emissions go up.
Thanks. I think that was a good explanation. There was a question, and it came from a Canadian supporter here. All this information that you presented, Lindsay and Jose, the information about how these studies have been made on carbon reductions and health benefits, etc. They want to know if this information is available to the U.S. government and whether the U.S. government is taking it into consideration.
Well,
feel free.
That is a great question. I guess I'll start since I'm already talking. And the answer is the American Lung Association, every study that I specifically referenced or highlighted, I know for a fact has been submitted to EPA in the formal comment collection dockets, both for the Clean Power Plan and certainly will be for the repeal and the advance notice of proposed rulemaking that Jose referenced for a possible replacement Clean Power Plan. So we are doing our part to make sure the studies that we've referenced are absolutely part of the docket that EPA receives from the public during the public comment period, and that they then have to review and respond to as they move toward making final decisions. Jose?
Yes, just a quick note. The benefits or the studies that I mentioned came from EPA itself during the Obama administration. We're understanding that some within the current EPA administration are trying to minimize or discount some of the benefits that were in those studies.
Lindsay, do you have a reference for the Harvard study? And if you do, could you type it in the little chat box for folks?
Yes, I do. I will pull it up and I will type it into the box. What I'll do is I'll link to a recent blog where the researchers at Harvard and Boston and Syracuse have, they are in the process of refreshing their information and updating it, but the blog that I will send is the latest that we have from them.
Great. The other question here is, it goes back to the inside the fence measures. Since they're more restrictive, is the rationale for advocating it purely economic?
So for those who are promoting an inside the fence line solution, part of the rationale is they have to do a lot less. They have to make the Clean Power Plan really over time would have supported a shift in our energy production toward cleaner energy. It created incentives for renewable energy like wind and solar. It created incentives and support for investments in energy efficiency. An inside the fence line approach where you are tweaking available equipment at a power plant does not accomplish any of those. And so those who are seeking to minimize changes to the current system support an inside the fence line approach far more than an expansive approach as was included in the Clean Power Plan.
Okay. I've gotten a few questions about the chat box. One of the changes it seems that any meeting did was to remove that. I have gone back into the system and I'm hoping that it is available for you at the moment. If not, just type your questions as you had been here in the Q&A. Question here. It has to do with the hearings. Jose, you mentioned that
I'm sorry, Paz, we lost you there.
Oh, can you hear me?
Yes, now I can. Could you repeat the question?
Yes, they want to know about the hearings as to whether or not there's a list of any other hearings besides Maryland, Delaware, and New York. I am not familiar with any. Are you or Lindsay familiar with any other hearings?
I am not. I understand that some states requested that EPA hold hearings in their states, but that wasn't accepted.
Pause.
Yes,
this
Lindsay.
is Lindsay. Their EPA announced before the holidays that they intend to hold 3 additional listening sessions, which is different from a public hearing, but that they would hold them in 3 cities. And off the top of my head, I believe it was Gillette, Wyoming, San Francisco, California, and Kansas City, Missouri. However, EPA has not announced the dates for these listening sessions, and they are likely to be held, at this point, I'm anticipating they will be held after the comment period closes on January 16th, because that's next week. It's hard to imagine that EPA would announce and hold listening sessions in the next week.
Right.
But we should keep an eye out for that.
Definitely, and we will send out notice if there's any listening session in your area. It'll come to you through email. This is a question, I think, for both Jose and Lindsay. Jose, if you want to take it first. Are there champions at Congress who could help? Is this solely something that's going through the EPA at the moment? So is there any congressional action that can be done? I think that's what the question is.
With regard to the EPA's intention to repeal the Clean Power Plan, not a lot, unfortunately, because this is an executive decision and a executive process. The best that we can do with regard to Congress, I would say, is to reach out to members of the House Climate Solutions Caucus, particularly the Republican members, and see if they can weigh in with the administration to ask them to keep the existing Clean Power Plan in place. That's what I have, and I can share with you that list.
Thanks. The next question is regarding comments. The question is whether or not comments to be in sign-up.
Pause, we lost you again.
The question is whether or not a comment through a sign-on letter counts, or if it's better to do an individual comment.
That's a great question. Jose, do you want to respond and I can chime in?
No, feel free, Lindsay.
So there are a lot of different ways to think about this, and it really depends on who is in the administration and what they're trying to accomplish, because there aren't any rules. So if an administration really wants to tout substantial public support, then 1,000 people on a sign-on letter helps them do that, and they'll count that as 1,000. If they're trying to minimize opposition to something they're doing, they might count that as one comment. Furthermore, if, organizations like the Lung Association, we put a link on our website and give you some sample language for submitting a comment. When we do that, we urge you to personalize it because that helps to set it apart from other comments that come through the same system so that they aren't seen as identical and therefore counted as one mass comment instead of individual comments. So at this point, I would say that the more comments, the merrier. And with respect to sign-on letters, sometimes there is an impact beyond what gets submitted to the docket to consider. So for example, our parents and grandparents sign-on letter, we have a goal of reaching 4,500 parents and grandparents who sign that letter. And you can probably guess the symbolism of that for us because that's the number of premature deaths that could be avoided if the Clean Power Plan were implemented. So we would then take that sign-on letter and release it to the press and tout the support and make the connection between 4,500 signers on the letter and 4,500 premature deaths that could be avoided as part of a way to drive the media narrative to focus on the health benefits. So that's a little bit of insight into that, and I would encourage you all to submit a comment one way or the other to make your voices heard.
Right, and if people go onto your website, they can find the link for commenting through there as well, right?
Yes, and I can share the link again if that would be helpful.
If you could in the chat box, that would be great. And I think the last question, though, that we're going to do today is also for Lindsay. And can you, in 1 minute, summarize the litigation that's in progress from the American Lung Association at the moment?
Not in a minute. A trick question, and I would say that I'm not an attorney, so I hate to speak on the litigation. But what I will say is that we are involved in the litigation from a health perspective. So we believe that that people whose health is affected needs to be protected. And while litigation is one of our last resort tools, we will use every tool in the toolbox to advance our mission on defending lung health and improving and defending the air that we all breathe. I'm happy to put you in touch, whoever wanted to get some more information on that with our attorneys to learn a little bit more about it.
And I did put there my email. If folks have questions that have not been answered, they can write to me and I will then distribute them to Jose and Lindsay. I did have one final thing to say here from somebody who's writing.
Pause if you're still there. I'm having trouble hearing you.
Yes, I'm still here. Can you hear me now?
Yes.
Yeah, somehow my headset moves, it seems. The question, not question, but the point to remember that we are talking about these issues from a health perspective today, but it's also to think about them of full creation issue that is being destroyed, and we're very aware of that. But today we were looking at the health impact. We're going to have to close the webinar at this time because of time constraints. I want to thank everyone, especially Lindsay and Jose. If you need more information, please go to our website. And I'm putting it up here in a second. Right there. We're also going to, at the conclusion of the webinar, there's going to be a very short survey. I ask that you help us to put better webinars together by responding to the survey. Thank you all, and God bless. Have a wonderful rest of your day. Take care.
Thank you, Paz.
Bye-bye.
Thank you.
Thank you.
Thank you.